Good morning. For those of you just coming on, we're going to give it maybe 30 seconds. But for those of you that have not already, please put your name and organization in the chat box, please.
No. I never.
And then if everyone would just make sure they're on mute. All right, well, let's go ahead and get started. So I appreciate everyone being on this morning. I know we had a retreat yesterday, so a lot of the folks, we were able to see each other. So thank you for attending that, and thank you for attending this morning. So just a quick look at the agenda. So basically, we have Lori on from the Carbondale Community Cabinet for Children and Youth, going to let her present. And then I'm just going to discuss a little bit about our community health improvement plan and kind of what the updates look like that for our quarterly progress reports. So it'll be fairly straightforward meeting this morning, and then we're going to do community updates from the action team. And then if anyone has any additional updates, we'll get to that as well. So appreciate everyone being on this morning. So let me pull up Lori's slide here. Okay, well, so Lori, I do want to thank you for coming on today. And you're going to be talking a little bit about the Carbondale Community Cabinet for Children and Youth. So if you would please give us an introduction, and
Sure.
the floor is yours. And I will move these slides. Just let me know as
Okay.
you're ready.
Thank you so much, and thanks for having me today. Many of you know me from my old role. I was an agency director at Child Care Resource and Referral for 31 years. I see Jeff Franklin on there, who coached me about my retirement. I have always appreciated those talks. I retired in 2021 with the idea that I really wanted to focus on local systems building. And I have, in that role, I have two jobs that I have undertaken. One is the Southern Illinois Coalition for Children and Families, which is now an 18 county-wide coalition that focuses on children birth to 5, coordinating, collaborating, connecting systems to make everything stronger. But a lot of things can't happen at a regional level. We found that there were some things that had to happen at a community level. At the same time this work was happening, we had 2 school districts that were engaging in some work with Harvard. And we learned a lot about this idea of children's cabinet. So I'm going to kind of give you some context of how we got where we are and then what we're doing. So the Carbondale Community Cabinet for Children is a collaborative partnership between the greater Carbondale community, and that's an important distinction. It's not just the city limits. It includes all 4 feeder schools, because in the end, we know that all kids end up at Carbondale High School, so we want to make sure that we're encompassing everyone. So that group, and then it is supported in some levels by the Southern Illinois Coalition for Children and Families. So it was really community generated and kind of really down in the ground roots coming up from members of the community. Next slide. So this slide represents kind of 2020 for all of us. So for the city of Carbondale, it was the perfect storm. We were having declining enrollment at the university, our biggest economic engine. The economy was struggling, partly because of it, and partly because the national economy is struggling at the same time. And then COVID hit. So we had a lot of things that were happening that made the community need to take a look at itself and reset. Next slide. So what we know is in our community, people really rally to respond to the issues. At a business level, SI Now, the chamber, other business groups really jumped in. SIU was really an engine in multiple levels, medical and economic and educational. And of course, our public health and private health providers, all the wonderful things that happened to not only get us through COVID, but restart our engine as a community. Next slide. Our school districts, and not, I like how our districts is misspelled, so I just saw that. So they know how to spell districts. Obviously, I do not. But our school districts had also done this, stepped up to the occasion, and they really did a great job getting kids through COVID. But what happened when they got out of COVID is they faced a lot of new challenges at every level. A lot of them were behavioral, social, emotional. We have one district in our region that last year, between November 1st and December 10th, I want to say they had 7 crisis referrals or 11 crisis referrals and 7 kids hospitalized due to mental health issues. So all of a sudden, not only did they have to take care of educational needs, the social emotional needs and all the resetting that families were going through coming out of this crisis and trauma, our schools were asked to deal with this too. At the same time, schools were being asked to do extra things in terms of meeting students' needs. And what we saw is they couldn't do it alone. And it was really time for our community to step up and support what we saw were the needs of children and youth in our communities, so that the schools felt like they had someone and families felt that they had someone in their corner and could back them up. When they were trying to make referrals to programs, sometimes those programs didn't exist or there were many obstacles. And that was one of the things that started the conversations in our community about the need for a children's cabinet. Next slide. At the same time, we had 2 schools, and this is really a feather in our cap as a community. We had 2 schools that were working with Harvard on what they call individualized student success plans, and that was Carbondale District 95 and Unity Point. And one of the components of individualized student success plans is not only identifying the student's needs, but making connections to those things that the student either needs or is interested in. And Dr. Paul Ravel from Harvard's Ed Redesign Lab was here in Carbondale and did some presentations, and he talked a little bit about the idea of children's cabinets. And what he basically said is that this would be a systemic way, not just let's do this today and it's gone tomorrow. Let's create systemic children's cabinets to make this village that we need for our children in our community happen. Next slide. So we approached the city manager, a group of interested people approached the city manager, pointing out to him that this Carbondale's at the time strategic plan and their summary only mentioned children and family 3 times in an entire plan. And if we want our community to be a place where people want to raise children and we want our children and students to thrive, they need more than 3 dot points in a large strategic plan. So we put together a 10-member planning team that included a diverse group. So people, school superintendents like Janice Pavalonis and Dr. Lori James Gross, Patsy Jensen from Shawnee Health, Carolyn Harvey, who at the time was on the city council, someone from early childhood, Joyce Guy, who was a family outreach person. We had several people sitting on this planning team to look at what we needed to do in Carbondale to make this happen. And we really relied heavily on a guidebook that was set up by Harvard that was a toolkit. And we used those guiding principles for 12 months to kind of go through a process to see what we thought could happen in the city of Carbondale and what it should look like. Next slide. So we launched a children's cabinet in the fall of 2022. I think that's right, 2022. And we were very intentional about systems connections. So we used, in all of our collaborative work, we've really used the model of the Healthy Communities Coalitions a lot in how you've operated and how you've set goals and managed goals. And how you use a collective impact approach. So we made sure as we designed this cabinet, there are what we call some sector representatives. So there's somebody that represents this group, and that's Fanta. And so she's a direct connector to the cabinet. She represents the Healthy Communities Coalition. We had a lot of talks. So if we want health to be represented, who's going to be represented? It's going to be SIH, it's going to be Shawnee Health, it's going to be Chessie, it's going to be SIU. And we said, wait, they already have a coalition. Let's connect to their coalition so we don't duplicate any work and so that we keep those lines of communication. Other groups like police department, the library, the park district, the city, Jackson County Health Department, because we wanted public health to be represented, and that's Sarah Fager, who sits on our board. And so we put together a group. Then there was 9 at-large members, and the idea of the at-large members was we wanted representation from every school district in some way, shape, or form, and from different communities to really represent different lenses and the diversity of the children and families that we were there to work for. So our goal is we want the Carbondale community to be the best place possible for children and students to grow, learn, and succeed. And we know by working together, we can better address the well-being, just like you guys are doing, the well-being, development, education of children and youth living in the greater community. We are looking at a cradle to career approach across all sectors, and we are committed to not duplicating efforts with anything that's already happening. Next slide. So what we've talked about before, and this is nothing new, so I'm not going to spend much time on this because you guys do this all the time and you're the masters at this. We use a collective impact or systems approach. So what's the difference? Next slide. So this is where people sometimes get confused when they talk to us about what we do. We're looking at systems building. We are not going to be a direct service provider. So we want to address the root causes and the focuses of challenges and obstacles so that we can make long-term change. We want to transform underlying structures and policies, mindsets, and dynamics. And then we want to strengthen the collective power of what we have as a community. And if we have gaps, we want to work together to fill those gaps. We don't see our role as providers of service or someone who's ever going to go get grants to fill in those gaps, but facilitators of making those connections to help those gaps be filled so children can be served across all spectrums and across all ages. We don't want to provide immediate assistance or support. We're not designed to address a specific issue, and we don't require, unless something happens, unless it's a new resources, dedicated resources. We're talking about mobilizing the resources that are in the community, strengthening them if needed, lifting them up and making them available to families when they need them and want them. Next slide. So there are 3 pillars of our work. And we have been working for the last 2 years closely with a consultant from Dr. Daniela Louie from Social Determinants of Health Consulting. She's also very involved with Harvard Ed Redesign and the By All Means convening, which is a lot of the children's cabinet works. So everything is based on these 3 pillars. That data. We use a lot of data. We spent the first year doing needs assessments, we did crosswalks, we looked at data from every different way, shape, or form, and collected them. We used a lot of the community health assessment data from Jackson County Health to start to figure out what our priorities should be. Equity, we believe that everyone should have the same opportunities to succeed and thrive, and we want to make sure we break down barriers to equity, and that children, youth, and families really should have a voice in this process. And we're struggling with making that happen, but I'll talk a little bit more about that in a minute. Next slide. So the other part we want to do is we want to make sure that for our schools who are doing individualized success planning, that we want to connect our work to their work. So for instance, if they have a student success plan, they're providing data to us to say some of the things that their students are needing in terms of programs and services and wanting in terms of enhancements. Then we share the data. We look at the data. We share that data with our impact tables, which are like your committees, and then we implement system strategies to maximize the resources and fill in the gaps. And then it goes back, because once those happen, then it's easier for the students' success planning. So it is a circle, and we work cooperatively together with those districts and all of the other districts as well. Next slide. So we want to make sure that we're aligned. And one of the things I looked at your plan, I thought, oh, we need to make sure we align with this as well. We've looked at the school strategic plans. We've looked at the city's strategic plan. We've looked at other project initiatives, and we definitely need to look at your plan. I saw several things in there that we need to align with. Schools goals and other coalitions and collaboratives. So again, we want to make sure we're not going in our own direction. Our goal is to kind of go in the same direction, get on the same train, and provide a maybe a little bit of different boost or a little bit different lens or capacity to get the work done. Next slide. So we have a hybrid model of membership. So I talked about that before. We have sector representatives and individual and community representatives. We sent out an application to the public. It was open to anybody. People could apply. Then there was a process of interviews based and with a rubric for scoring. And based on the rubric, people were chosen for those at-large positions. Those first positions lasted 2 years, and we just finished the first 2 year cycle. And most people re-upped for the next 2 years because I think they felt like we were getting a lot of momentum. Meetings are always open to the public, and we encourage anyone to participate. We have 3 impact tables, and people are asked to the general public to participate that as well as our community conversations. Next slide. So we launched in September 22. This was our list. I kind of went through this process, so we can move to the next slide. And one of the tools we're using is community conversations. So we started with an early childhood one because we had gotten special funding through Birth to 5 to host that and to pay for our consultant, and that was from Sleepers to Sneakers, and it focused on children 0 to 5. Then our next one was on high school kids. We had a really wonderful community discussion with the high school kids who were a panel that talked about what was it like to grow up in Carbondale, and what did they think was great about it, and what did they not like about it, and if they were in charge, what would they do? And then we coupled those community conversations with pertinent data and put those two things together, the analytical, the statistical data and the analytical data, and put those together to come up with some priorities. This year, we've had 2 additional community conversations. One has been around out of school time, and the last one was around childcare. Next slide. So we have currently we have 3 impact tables. We call them impact tables. They're the same as a committee or task force. One focuses on early childhood, 0 to 5. One is about access, and it's access to everything: access to healthcare, access to out of school time, access to extracurricular activities, access to financial help. What are the barriers to access? And the last is about this youth voice, student voice. And that group has been working to launch a youth congress, partnering with the high school and the city. The mayor wants to have a youth advisory committee. And so we started that process by having listening sessions with high school students last spring, and then an applications process this fall. We only had 4 students being nominated, either themselves or nominated by staff or another adult. They could self-nominate, their teachers could nominate them, their peers could nominate them, a relative could nominate them. There's lots of different ways to make that happen. So we're going back to the table with the high school and the mayor. We feel like maybe if they started with the mayor's advisory group, maybe there'd be a little bit more interest, but we're going to work with those 4 students to help us figure out how to recruit others. The idea is that they would be the standing group that could serve as an advisory group to any entity that needed it, that needed that youth voice. So if the city is applying for grants and they have something to do with the youth, they could ask their opinion. They could ask them for letters of support. In New York, they have a youth congress, and they actually read some of the community grants, and they say that the high school students are much harder on those community grants than the adults, because they'll say things like, nobody will ever use that, or that's not how it works, or no, that's not right. And so we know that they have a valuable voice in helping shape the community in which we hope they stay and live in for the rest of their lives. Next slide. So every impact table has been asked to set a SMART goal, identify 2 to 4 strategies to meet the goals. Obviously, this sounds very similar to you guys. Develop and implement action steps, and to do ongoing reflection and evaluation. And all of those impact tables are working right now on specific projects and specific goals. Next slide. So some of the things that we've talked about, I talked about the high school listening sessions and working on Youth Congress. We are working on welcome to Carbondale bags. We know that there are some done with this through the chamber, so we're working in partnership with them. We really want these to be to all families. And we're working with Saluki Ad Lab to develop a digital resource guide for those families that can be updated with some different things that we think. We want families, when they come to our community, to feel welcome and know that it's a community in which they are valued as well as their children. We, each spring, we've been distributing kindergarten readiness bags to families around specific things that the kindergarten teachers say they are needing, which is self-help skills. And so they're getting Montessori boards to help them learn how to buckle and snap. And parents are getting a letter that says, you know, getting ready for kindergarten is more than ABCs and 1, 2, 3. Make sure they know these self-help skills, that they can, you know, manage their bathroom and hand washing skills, and they know how to manage their clothes, and they're getting a book the night before kindergarten or another book, and they're getting some materials for resources that are happening in the community over the summer, and then they're getting this special gift for their kids. And those go out through the early childhood programs, through the library, through the park district, and then we've gone to parks, and people can pick them up at designated times at the parks. The first year, I think we did 380, and last year we did about 300 because the population, the census of children was down. We promote early literacy by promoting the Dolly Parton Imagination Library. The Southern Illinois Coalition, the Southern Illinois Community Foundation, and the Walker Bourne Foundation are co-conveners of that. It's for all 18 counties and serving 18,000 kids. We are working to make sure all the kids in Carbondale are signed up. That means that they get a free book every month from the time they're born until the time they actually turn 5. And then we've done an inventory of after school programs and services, and we have a comprehensive database that we're working on converting that. So parents, if I'm looking for music lessons, or I'm looking for sports, or I'm looking for art, or I'm looking for drama, or I'm looking for a different kind of activities, it will be easier for parents to find. And we're in the process of putting that together and figuring the best way and the best platform to put that information. Next slide. So this is an old thing, but we invite people to join us. We usually meet the last Monday of every month. This month, we're going to meet via Zoom, and we're going to talk about, we've been doing our meetings at night, and we did that so parents could attend. And what we have found is it's problematic not only for parents whose kids have activities in the evening. We've been meeting at 4:45 and to 6:30. It's also been problematic for many of our members, so we're going to be looking at that structure, maybe moving to a hybrid structure of having some day meetings and some night meetings, but looking at how we can break down that barrier to participation so more people can attend and be part of this work. Next slide. And that's it. Infanta, since you are the representative for this group, if you wanted to add anything, please feel free.
Appreciate that, Lori, but you've covered it all. Thank you.
Infanta is a great representative.
So Lori, thank you very much for your time this morning. It sounds like you guys have been doing a considerable amount of work. So you mentioned, maybe some, I don't know, hesitancy, or I guess what's kind of the biggest challenge that you're running into with, maybe trying to engage youth, or can you just talk a little bit about what your challenges might be and how we might be able to help out?
Yeah. So I think, and then I think it's it goes both ways. I look at some of your goals and I think there's ways we could be helping out. So I think the biggest challenge is engagement, honestly. And it's not engagement necessarily to come to we need people that can do the work and we want to systemically embed this into the work that people do. So, we're trying to make it not big add-ons, but how do you embed it into what you're already doing? So I think, for the youth, we really need to go back into the high school and have face-to-face conversation with them. Like they got the form, we were there in the spring and they were very excited. And then we went in the fall and it was done by paper, and we think there needs to be more face-to-face there. So I think we've got some good strategies. The group's got some good strategies. We just had a meeting Monday about how to do that. And we do think that the mayor kind of coming in and doing an ask gives a little more teeth, and they get a sense of the kind of work they're going to do, because this is a difficult thing to understand. I think for the other work, it really is about, we've got to find better ways to engage others so that we can get the work done. I'm not a paid consultant. I'm doing this as a volunteer. Most of my work, I get paid a little bit I get paid some through the coalition, but most of my work with the Carbondale cabinet is just as a community volunteer. And I'm happy to do what I can do, but we know we've had members say, if I could meet during the day, I could be at every meeting. And if I could do this here, I could do it as part of my job, but at night I can't. So we're trying to figure out how to mobilize our resources in a more member friendly way to make things happen. And make sure that, at the same time, we're not duplicating. So an example is, connecting to the community schools work that's going to be happening soon, and maybe this group serving as a part of their advisory group, or their advisory groups instead of creating a whole other entity. We're trying to not duplicate wherever we can and mobilize people as much as we can in a way that doesn't overtask anybody, and keeps the encouragement, the excitement, and enthusiasm going. And that's been hard for every group that I've been involved in. I think, people came out of COVID tired, and people are still stretched thin. And I think people learned about boundaries, which is a really great thing. But we have to do our work differently and not expect people to, be exhausted, and that's how you make a difference. And so, we're kind of talking about, if everybody does a little, we can achieve a lot. And how can we break up our work into smaller bites so people feel part of the work without feeling overstressed or stretched too thin.
Great, thank you. So while everyone's thinking of potential questions, I just have one more. So you did touch on kind of funding. Are you guys looking at, more grant dollars? Are you looking at foundation funding, or, can you talk a little bit about that?
Sure.
What your perfect world would be?
Well, the perfect world, our dream vision is we want a youth coordinator for the city of Carbondale. And the youth providers all agree that we need one person that can be going to all the meetings and helping connect the dots and building the relationships, and so that we could have a comprehensive plan for children and youth in the city of Carbondale. So that obviously is going to require some funding. We were approached by the Children's Funding Coalition, which is a national group, about being in a cohort. And they teach people how to leverage public dollars to fund this kind of work. But we needed to pull together $80,000 in a very short amount of time. And we couldn't do that to be able to fund this position. So we're still having conversations. I'm having conversations with Pichards. In the next couple of weeks, we've had conversations at the city level. We do get a grant from Birth to 5 Illinois, which we've got. This is our third year. It's a small grant at $60,000. But we have, it focuses on children 0 to 5, but we use those funds as much as we can to leverage the whole cradle to career. So for instance, for this grant session, and it's only a 6-month grant session, we were going to hire an early childhood coordinator. And we're doing that with the library, which gives them additional funds because their children and youth program has expanded and they need more capacity. So because they're getting management funds that allows them to have extra hours, and we're going to have someone that can focus on the early childhood grant pieces that we want to have in place. So that's one thing that we're doing. So we're trying to strengthen that. Another thing we're going to be doing is we've got many kids that aren't connected to early childhood programs, either because they're on waiting lists or because the parents haven't enrolled them, or they're new to the community. So we're contracting with the Science Center to do what we call these pop-up play and learn groups, starting in March, that are geared towards kindergarten readiness, and they'd be every Friday and they'd be free. And they'll be developmentally appropriate, aligned with kindergarten strategies, and working with our kindergarten readiness indicators, and aligned and working with those school districts. So when we do get grants, we're really putting them out in the community. Some of our grant money will go to Dr. Louie again to facilitate some of the work that we need for a consistent thing. And then we use some of the grants for materials for the kindergarten readiness bags. So eventually what the group really looks and hopes to get. Oh, and the other thing she's going to do is she's going to do research on youth coordinators in other communities. So we've really relied a lot on what's happening in other communities. We've been participating in Harvard, and Jeff's been part of this By All Means convening. And we've been able to be at Harvard for several years. And so we've got lots of good connections with other communities that are doing this work. So we'll be looking at other communities that have youth coordinators. How does that look? Where are they housed? What does it cost? How does that, and coming up with some models to take back to the city or to the group to say, how could we do this either collaboratively, and where does it make the most sense that it's housed? I know when we talked about it this spring, there was concern doing it in the city because it would be a position and everything that goes into creating a position, which if you're part of a bureaucracy, you understand. And that's why we went to the library, and it was a win-win for the library. So, eventually we want to grow, but we're trying to do it in an intentional, thoughtful way.
All right, well, thank you. That's good information to have. And I think with, potentially a new city manager coming on board, that's probably a good opportunity there. So
yeah, and we have city representation. Lauren Becker is a member of the cabinet, but we often have city staff come to our meetings, which has been really helpful.
Great. So do we have any questions from the coalition group here? If you just raise your hand and I'll call on you folks. Just scrolling through to see. We've got pretty good attendance this morning. Well, if we don't have any questions, obviously we've got Lori's contact information, and we can put you in touch with her as well. So with that, again, we really appreciate you being on this morning.
Sure.
Sounds like a lot of great things going on just in a few years' time. So hopefully you guys continue with this momentum, and we appreciate you being on this morning.
Thanks for having us.
All right. So moving on, the only other thing that we had this morning that I wanted to discuss is kind of this new format that we're trying to go to for community health improvement updates, and then also action team report updates. Basically, I merged them all into one form. Now, the hope with this document is we're hoping that it will live online somewhere through kind of a Google Doc, something like that. But we're trying to make it available so you don't have to use a password, or you don't have to need any sort of logon information. So we're still trying to work through that. And this is the first time a lot of you guys have seen this. So it looks more intimidating than it really is. But basically, at least for the first portion of this, these are all the health priorities, the strategies, and the activities that are included in our 5-year health improvement plan. Now, what I'm asking you all to do, and this is only going to be quarterly, is basically for each one of these activities, if you have an update, just enter them right here, just like they're highlighted. And really, I want this to be kind of a running report. So we're going to continue to count encounters or trainings, whatever they happen to be. But basically, we want them to be cumulative, so they continue to add on quarter to quarter. That's going to give at least me a better picture of where we might be falling short. And then obviously for some of the grant reporting things that we need to do, it just makes it easier after the 5 years are up. I will mention on a lot of these, you can kind of see I've listed our coalition. Those are typically like where there might not be a traditional lead agency, but a lot of us are kind of working in these areas. So that's where you'll kind of find those. So really it's just, if it fits, that's great. And some of you just email me those, and that's fine too. So if you don't know exactly where it lives, you can just send that information to me. I'll find a place for it. But really, we're just looking for any community updates that you all have. And again, this is only a quarterly thing, so it's not something that you're going to have to continuously update on a weekly basis. We're just going to do it once a quarter. But this is another good tool to see all the strategies, the activities that we're working on. You'll see like, the consortium for Catch, they've got some areas that they're probably the best lead in. There's definitely some that are relevant to Jackson County Health Department, like the Bright Smiles fluoride treatment. That's something specifically that we do. And some of these are kind of like, well, the coalition, built environment, healthy living probably does some activities. So just wanted to give everyone kind of an opportunity to see what I'm hoping to get out of this. And really, it's just more about capturing that community level work that I don't always know exactly what's going on in kind of all your agencies. So it's a helpful tool for me. Now, kind of the ending, and we'll transition into community updates here. So basically, I just put this at the end, but we have all our different action teams, and some of you sent me some updates for this quarter, which I appreciate. And I know a lot of you guys will update me today or put it in the chat box. That's fine. But basically, I'm going to capture all this information here, and then we're just going to make this available on our website. So we have the recording that we also put on our website, and then also we have all these updates as well as all the group chat. And basically the intent behind that is if you happen to miss a meeting or you wanted to look at something at a later date, that's why we make it available. And it's always up there until the next meeting occurs. So that's what we're hoping in this new document. And if anyone has any questions, just let me know either today or we can address them at a later date. That's fine. So do we have any initial questions? Okay, Well, let's jump into community updates. So do we have anyone on from behavioral health? I know they've had some changeover, so maybe not. Do we happen to have anyone for built environment? I saw Molly emailed me something this morning, but I don't know if she jumped on. Okay, moving along. I know Fanta's on. Do you have any updates for Diabetes Today resource team?
Good morning. So our update for today is that Camp Beta 2025, so save the date, that will take place on September 6th through the 7th. And that it will be at Touch of Nature as usual. For anyone that's not familiar with Camp Beta, it's a camp for youth 10 to 17 years of age living with type 1 diabetes. So it is an overnight camp, and I'll put more information in the chat about that. And the DTRT will meet next on February 27th from 11:30 to 12:30.
Great, thank you very much. I did see Claire was on. Claire, Tony K, do you have anything for Healthy Living Action Team?
Hi, Matt. I will start, and then Claire, you can jump in if you'd like. We will start our meetings for 2025 on Monday, February 3rd. It will be a little bit longer meeting from 1 to 3. We really need to refocus on building our strategic plan, kind of following with what you just shared, Matt, and some of the information coming out of the SIH Community Health Needs Assessment. So we will be meeting in person. We do have a virtual option available as well. So that first meeting of the year will focus on strategic planning, and then we'll meet every other month, the first Monday of the month. Our location this year is changing from the Carbondale Park District office to the Jackson County Health Department. So for people who are joining us in person, we will now be at Jackson County Health Department. In regards to program updates, the mobile teaching kitchen cart will be at the indoor farmers market on Saturday, January 25th from 9 to noon. And then a save the date has not gone out, but we have secured the date for the 5th annual Southern Illinois Food Security Summit, and it will be Wednesday, August the 27th. A save the date should be coming out next week, probably. Claire,
Great.
anything to add?
No, I think you covered it.
Great, thank you very much, Tony K. I think I saw Becky on for Healthy Senior Action Team.
Yes. So just a couple of updates. We had our caregiver retreat in November, which was a great success. We had 50 caregivers from all over Southern Illinois. They came in for a day of pampering and networking, and just a day where we can focus on them and the work that they're doing on a daily basis. We've decided we're going to make some changes to how we run the event in 2025. So we were excited to get some feedback from our attendees, many of them repeats from the previous year. Our next project we're working on is adding to our caregiver retreat another event next year, or I'm sorry, this year, I keep forgetting it's January, the senior prom, which I know I've talked about on the last couple of meetings, but we're really excited about that. Hopefully we'll have a date selected soon. We actually meet today. Our meetings are always the third Thursday at 3 p.m. So we will meet today at the U of I Extension Center in Marion. So if you're interested or you know of anybody else who works with seniors, send them our way. We would love to add some new members to our team.
Great, thank you very much. Fonta, do you have any joint access to care updates?
For joint access to care, we are determining what our role is, so continuing to figure that out with the Find Help implementation. So a few of our members will be a part of the implementation team. So just more to come as we put everything together. But our next meeting will be March 18th from 2 to 3 p.m. And I will put in the chat more information about the action team.
Okay, thank you very much, Fonta. Sherry, do you have any positive youth development updates?
Hi, yeah. So our next
family vacation night is February 6th. We'll be having a family Valentine dance again this year. It was a pretty big success last year, so we thought we'd do a repeat. We are looking for people to volunteer to work at the event or to set up a table and activity for their organization. And then we do have a few other family vacation nights in the works, more details to come on those. And our next meeting is January 21st. And if you would like to attend or just to be put on our contact list, you can let me know and I'll get you added.
Great, thank you very much, Sherry. So moving along, I think everyone probably should know. So once upon a time, this public health and medical preparedness group was meeting, and Kitty Jewell from SIU and Bart Hagston and a few other people were a part of that. And it's kind of been suspended because we have the Shawnee Preparedness Coalition and some other people are working in that area. So I don't know if we'll just get rid of this altogether, but I've left it on the list, but they're not currently meeting. So if you're part of that emergency preparedness world and you're wondering what's going on, that's the update. And you can reach out to me if you have other questions. So sexual health, do we have Philip on?
Yes, so we had our last meeting on December the 11th, and we began by reviewing the response that we have gotten to sexual health resource packets that we sent to superintendents of school districts in Jackson County. It was the resource packet was specifically addressing the State Board of Education's implementation of the comprehensive health and safety for K through 5 and comprehensive sexual health curriculum 6th through 12th grades. Thus far, we have had a good response. We have had in-person meetings with the superintendent for Unity Point, Giant City, and DeSoto school districts. We also took a look at a video. We viewed it together at our meeting from the American Sexual Health Association. It was entitled Talking About Sexual Health and Getting the Care You Need. Very interesting panel and discussion about the importance of including sexual health in all settings, primary care and on. The group felt that it was very helpful because there were some views shared from patients who really brought forward some of the challenges of having those conversations with their providers. And then specifically on our outreach to the community, we've provided a sexual health lecture to public health class at SIU, and then also Shawnee Health, Carbondale Primary Care, Murfreesboro Primary Care, and Carbondale OBGYN. Our next meeting will be February the 12th, and I believe we're going to do something a little different as far as location. So our meeting always falls on the second Wednesday of even numbered months. And we will always, unless announced earlier, meet here at the health department at 3 o'clock. But our next meeting we are considering having at the health department's sexual health outreach office, which is located at Irma Hayes Community Center in Carbondale. So that meeting will be again the second Wednesday of February at 3 o'clock at Irma Hayes Community Center. If you would like to come and join us, even for just that meeting, to see the sexual health office and the resources that we have there, as well as being able to provide HIV and hepatitis C testing right there on site, please join us. And that's my report.
Great. Thank you very much, Philip. It's always fun to look at your report. You've got so many things going on, so that's great. We appreciate it. I don't know if Angie Bailey's on for Southern Illinois Cancer Action Network. I know she has the retreat yesterday, a lot of things going on.
I can give an update. This is Emma Ray.
Okay, great.
Yep. So our Southern Illinois Cancer Action Network meetings, they occur on the third Tuesday of every other month. We're continuing our virtual meetings with guest speakers and discussion on the Illinois Cancer Plan, as well as updates from the team on upcoming events and ways they are implementing education and cancer screenings in Illinois. If you would like to join these meetings, you can reach out to Angie or myself and we will get you added, and I can put our emails in the chat. The next meeting is Tuesday, January 21st from 2 to 3 via Teams.
Great. Thank you very much, Emma. So for community reports, just one thing that I wanted to mention. This was sent out, I believe, this week. So Jackson Mass Transit has a survey out. I actually took it. It's very easy. It's going to be less than 5 minutes. So the link is there. It's also on our social media as well. But they're looking at developing a plan, trying to get more efficient with transportation. And it's a quick survey, so please do take that. Yeah, so it's right here. It's open for another month still. Other reports. I don't remember. I received these flyers from someone. So if they want to come off mute and talk a little bit about these.
That's me. I'm Shannon Green. I'm working with the Southern Illinois Coalition for Children and Families, and we have some funding from the Pritzker Family Foundation to start exploring the idea of bringing a short-term nurse home visiting program to the entire Southern Illinois region. So we have two different things that we're sharing today. One, the flyer that's on the screen right now is we're trying to get to interview some parents, pregnant or new parents that have brought a baby home within the last 2 years. And for the families that we're able to interview, we'll receive a $50 gift card, and we'll just be asking them about their experiences with healthcare, what kind of support they had after their baby was born, what they wish they had, things like that. And the other thing is an invitation to an information and planning meeting. We're actually holding 2 in-person meetings on the first week in February. And I put a few links in the chat box that you can register for those meetings. Do you have the other flyer, the second flyer I sent? Is that on there? This one here. So that flyer, and I also put a link to the flyer in the chat box. So that shows the options for registering for those meetings. And then the third link that I put is a direct link to register for those Googles. We'll do the first meeting will be in Vienna on Tuesday, February 4th. And the second meeting will be at Johnny Logan College. They're from 11 to 1:30, but we will provide lunch. And for those who cannot attend an in-person meeting, we're going to do a shorter Zoom version the next Tuesday, February 11th. Does anybody have any questions? Or I know I was talking pretty fast. All right, well, thank you.
Yeah, thank you very much, Shannon. So that's all I had for the updates that were sent to me before the meeting. Now, do we have any updates for today from the coalition? So just go ahead and raise your hand. So I'll actually call on you here. So Mandy Hagan, go ahead.
Good morning, everyone. Thank you for having us here. I am Mandy Hagan with the Perry Jackson County ROSC through Take Action Today, and my assistant is also here, Kelsey Driscoll. But this is our first meeting, so we are super excited to become a part of this. And I just kind of wanted to talk about our ROSC and Take Action Today and what we're trying to do over in Jackson County. So we have a resource center located at 809 West Main Street that operates daily from 9 a.m. to 5 p.m. We offer peer recovery services to help with homelessness, mental health, and substance use. we believe recovery is possible for all individuals, and we just want to help get them there. We offer free showers, free laundry services, one-on-one help. We use other community resources to help them, basically, hopefully, to meet some of their basic needs that they are trying to meet, and to help them set goals in reaching sustainable long-term recovery, whether it be from mental health, substance use, or homelessness. We actually opened up our resource center last November of 2023. And this year, starting January 4th, we actually opened up to be a 24-hour warming center, which will actually shut down today. But we had 8 to 15 guests that would stay overnight, and anywhere from 25 to 40 visitors during the day that would come in to get a meal, just to get out of the elements, whatever. But we have been able to house the individuals that have been staying overnight. We have either found them shelter, somewhere safe to stay through shelter, the Carbondale Warming Center, or we also have a Benton Warming Center that is going to continue to go on, that we've been able to place a couple individuals at. And that's something we're going to work towards for next year, because the Carbondale Warming Center, they get overloaded quickly, and we do work with Carmelita closely. And so that's going to be something we kind of put in an action plan to kind of figure out how we could create it non-emergency. Like, we literally just decided to open and stay open over the weekend because we had people that didn't have anywhere to go. And it was during that freezing ice coming in. So that's going to be a plan for this year, is to kind of help how we can implement a plan to keep that going open, probably for at least, a month during the cold time. But we have a ROSC meeting monthly. It's the third Wednesday of every month at 1 p.m. And our next meeting is February 19th, if anybody is interested in attending, just to kind of see what the ROSC is about. And it is going to be at our TAT location. So you guys, even if you're interested in seeing what the resource center is about, you guys could come visit. We also do it by Zoom. I don't have the link on me to put in the chat right now, but I can email that to you later. And we are actually right now, we're fully funded through the state, the ROSC is. So we are putting together, we just created a community survey that talks about recovery from substances and homelessness and mental health, that we are going to keep open until the end of January. But we are putting together an asset map of the resources throughout Jackson County. And just from listening to a lot of you guys speak already, I feel like we could collaborate and put a bunch of resources together, and they get posted on the Governor State University website and passed through the Illinois Department of Human Services and IDPH. It's a requirement that we do. And we also have to come up with, we did a community needs assessment last year. We have to update it yearly. So those are just some of the things that we do for the state end of it. But we are currently trying to plan a few events through Jackson County for this spring and this summer. We want to do some anti-stigma events, like Recovery is Possible, whether it's homelessness, substance use, mental health, any type of health. We just want people to have positive health in their life. So we are thinking about like anti-stigma to advocacy, and we don't know if we're going to plan this. We're hoping to be able to plan with different agencies in the community, just to be, whether it's like a big resource fair or just a educational event possibly. We're not really sure which way we want to go. We are working with some other community agencies on it, but the more community agencies we have, the better. And that's just some of the updates that I have for now. And thank you so much for allowing us to be a part of this.
Great. Thank you very much, Mandy. A lot of things going on, which is great. So anyone else updates for this morning?
I'm Kelsey Driscoll. I'm gonna take action today as well, as Mandy said. I did put the link to the Zoom meeting in the chat.
Great, thank you very much. And then here in the chat, so Michael Shelton was wanting Mandy's contact information. I don't know if you can put that in the
Yep,
chat.
I will add it to the chat.
Great, thank you very much. So any other updates for this morning? Okay, hearing none. So just a reminder, for our meeting schedule coming up for next year, or for this year rather. So we are planning to meet in person April 17th. We haven't set the location yet. It's probably going to be in Carbondale, I would imagine. And then we're going to flip back to remote WebEx like we are today in July. And then we're hoping to meet again in person. So basically it's going to be 2 meetings in person, 2 meetings over WebEx. And then after this year, we'll kind of see if we just want to go back to full-time in person, or if we want to do something similar, if we want to add meetings, shorten them. We used to meet every other month. We've gone to this quarterly schedule. It seems to work okay. And obviously we've got some other action teams meeting throughout that time. But just wanted to remind everybody, and I'll let you know where that location is. But the next meeting, April 17th, we hope to do in person. And that's all I had for this morning. So I'm not seeing any other raised hands. And some applause. We appreciate that. So other than that, thank you very much for being on this morning, and we'll see you guys in April.